I'm Adrienne. Welcome. Thanks so much for tuning in today. And today's show is about physical therapy. And I am bringing to you one of the awesome physical therapists here in Rockwall, Texas, In Balance Physical Therapy. And this is the owner, Nancy Cano. And today we're going to ask her questions about her business and what she provides. So Nancy, take it away. Tell me about how long have you been serving Rockwall and the Rockwall area?
All right, so I've been in private practice about 13 years now in the Rockwall area, and just started at a different location and then moved, and here we are in our last location. So we restored this building in 2014 and we moved in 2015, and we've been here ever since, and we love it. It's a real cozy environment. The purpose of this, the colors and the scheme, is for our patients to come in and feel comfortable and not have a sterile environment that I think promotes healing and better health.
Yeah, when I walk in here, I feel welcomed. Like, I don't feel alarmed or anything like that. So the colors does help soothe you to get prepared that you're going to have a moment with someone that's actually going to take care of your needs. And so, speaking of taking care of your needs, what needs can be provided here? What kind of services do you offer?
So we work mostly with women. We do work with men, but we consider ourselves a women's health and wellness clinic. So we provide orthopedic dysfunction services. So if you have back pain, neck pain, hip pain, those sort of things, that we address those as well. But we've also started to specialize in women's health, it's an array, a list of different things that can happen with women in their span of life, going from prenatal to postpartum to menopause. So anything that is dysfunctional or a woman has having problems with, specifically pelvic health, we work with that, along with examining the spine and other parts of the body, and then coming up with a very specific plan for an individual. So it's not a one-size-fits-all at all. They may come in with the same complaints, but their dysfunctions may be totally different.
So anybody that's working with you, do you want to highlight some of the staff that you're working with that's here, that's available?
Sure. So we have Marie Chandler, who's a physical therapist, and she specializes in Pilates. So we do a lot of our core work is Pilates based, and so she will see patients once they're kind of stable and they don't need any manual work. Then typically Marie will see those for advancing them through a little bit more advanced work with core work. And then we have Heather, Dr. Heather, and she is an orthopedic manual therapist, such as I, and she also specializes in women's health. So we have those two therapists.
So,
good team.
So it's not like a gym. You know, it's like it's one-on-one when you meet with these wonderful ladies that are here to help you. So, is there any services that we haven't discussed yet that you also offer?
Well, if it's okay, I want to kind of go back to the postpartum, because I've been getting a lot of postpartum patients come in, and the typical complaint that these poor little women are having is pain with sexual intercourse, that they've had some things going on and now they're having difficulty with sexual intercourse, and then we don't think much about that, and we don't really, our society doesn't want us to talk about that.
They don't want to talk about it,
They don't want to talk about it. And women are typically private, and we don't want to really tell our doctors, well, I'm having difficulty with sexual intercourse. And those things are important. They're important to maintain a healthy relationship with your significant other, and so that is something postpartum that I've been seeing a lot of, treating women that have postpartum have pelvic pain, and specifically pain with intercourse.
So no conversation is off the table when it comes to that?
No, you can't be that way. I think that's, historically, I think that's what we've always done as women. We've just like, I've got to suck it up and deal with it. Nobody's going to understand, and there are therapists, pelvic floor physical therapists, to help you work through that.
Well, that's encouraging to know that if you have any difficulty during sexual intercourse, that you have someone to talk to. Dr. Nancy Cano is the person to go to when it comes to that type of discussions and stuff. And those discussions are private, and that's between you and your doctor. And again, why is it that gynecologists? Can you explain a little bit why are they able to discuss that?
Well,
with their
I think that they're focused on the general wellness of the mom and making sure that the delivery was well and postpartum, everything, typically what my patients are being told, and I'm sure other women, is they go for their 6-week checkup, they do an external exam, and then they say, oh, you're everything's normal, you're cleared to return to normal activity. But then these women okay, I'm still having problems, I'm still having pelvic pain, and after 6 weeks, you're cleared to have sexual intercourse. But when you don't feel like it because you have pain, that's an issue. And I think some of the OBGYNs are starting to be a little bit more aware of it. But I think women have to be their own advocate, and they have to be able to speak out and speak freely.
So what you're saying is you're recommending women who happen to be going to an OBGYN, and maybe you should bring it up to your doctor and tell them about these type of things. And then would you mind releasing me so that I can be able to go and see Dr. Cano in Rockwall area, right?
Yeah, I think every 6 weeks post-op should follow through with an order for a pelvic floor physical therapist, just to rule in and rule out and let you go. Because, there's a lot going on when you're taking care of that new baby plus other kids along with it too. So.
And so dealing with stress, can stress be something that you can be able to handle here? Like if someone has, they're going through a lot of withdrawals, maybe from the medications that they're taking. You need some sort of therapy because it doesn't. We talked about this, I think, that we were talking about how these types of things affect our bodies and these toxins and things of that nature, and then our bodies feel these pains. So physical therapy will be able to help you.
So typically, somebody who has pain, or let's just talk about stress. So stress in general does a lot of physiological changes into the body, and it can make your musculoskeletal system tighten up, and then you end up with, oh, my neck is hurting, my shoulders are hurting, I've got a headache, my upper back hurts, my low back hurts. So that stress can feed into pain. Then physiologically, it can also start to decrease your immune system, because your adrenals are on and you're in that fight-flight consistently. And so the body is intended to, you can do the fight and flight, that's that run response.
Right.
The problem is our society stays there. We don't ever downshift. And so when that happens, that sets you up for musculoskeletal pain and some other complications. So.
And who wants stress in their life? And there is a relief, right? There is a relief, and I'm thankful that I got to meet Dr. Cano here, and she's serving the Rockwall area. So if you happen to be in Dallas or anywhere in the surrounding area, she will definitely be a great go-to resource to be able to not live with that pain. So, and there is a remedy recourse. So if you want to know, the website address is nbalancephysicaltherapy.com. She's also on Facebook, and she started a new podcast. So be sure to look out for that too, because she's going to give you some tips and helpful information to be able to let you be able to know that there is remedy for certain things, and maybe even some hot topics, that has to deal with sex. So, and other things too. It's we want to make sure that the type of topics that you're listening to is things that you could possibly be affecting you, and you can have a remedy to your issue. So thank you so much for tuning in. Be sure to subscribe, and be sure to check out Dr. Cano.